And good afternoon. This is Dr. Jerry Dreesen. I am the Executive Director for the AOPP, the Association of PEMF Professionals. And today what I wanted to do is talk about how PEMF is being used in the health spa niche. And you're going to see a lot more of these things popping up. They are part of different conglomerates. You're going to see mom and pop shops, but then also if you want to be part of a member, like a McDonald's, where you become part of that. Hi, Hazel. And one of the things that you'll see is the benefits of PEMF, and then people can go and check into these spas and get PEMF treatment. Now, it will either be the sole reason behind this spa, or it'll be an adjunct therapy to it. Something to think about if you have a PEMF machine and you're looking to expand your business, you can come on board with these spas and be there, so many hours of the day and share what's going on. And then also, because of your expertise, you can be the person that's doing the administration, and then they can also promote it, and you can do some cross promoting too. So some of the things that the spas are promoting is, that it boosts the immune system function, that it promotes better sleep, that it, hi Sandy, it decreases depression and anxiety, it increases physical energy, increases in bone healing and density, and that's huge, where you've got a lot of people that are becoming osteopenia or osteopenic, and the bone density drops a little bit. I'm going to take a little aside here. Some people think that when you have osteoporosis that it's a disease that you have to live with. All it is that your body's not absorbing enough calcium and putting it into the bone, so that the bone is getting weak. Our bones are actually a storage house. We store calcium in our bones. And when we have this thick density, if we're not absorbing and eating more calcium, then our body's going to pull it from our bones. That's our storehouse. And so osteopenia can be caused just because you're not getting enough sunlight, you're not getting enough exercise. And so that's a big selling point, if you can go into a spa and work on getting your bone density improved. But it also increases circulation. So those are some of the health benefits that we have from going into spas that can be, oh, there we go. Hi, Hazel. And there's Sandy. Hi, Sandy from California. And who else we have here? Oh, Lisa Marie. Hi. I was diagnosed with osteoporosis, and using MagnaWave second test came back greatly improved. And those are some amazing things that people don't realize with the osteoblastic activity that gets improved or sped up using PEMF. Again, I'll take another little step aside here as long as we're talking about that. With bone density, you have to make sure you're having the right ingredients. And so those of you that listened to Paul Harvey nationally, a long time ago, he talked about a product called Citracal, and that has all of the basic things in there. And hi, Wendy, see you again. And you have the absorbability needs to be there, and you need to have good acid in your stomach. And it needs to be a calcium citrate or calcium citrate versus a calcium carbonate, and that's what's inside Tums. And some people think that you need to take Tums, or that it's okay to take Tums for calcium. But here's two things. Number one, it's the wrong kind of calcium. And number two, it neutralizes your acid, so your body can't absorb it anyways. So if you're working that angle for, increasing your bone density, the right kind of calcium, keep your stomach pH. As we get older, our body produces less acid. So some people just have an absorption problem, and that's why they sell hydrochloric acid tablets in the stores. You take them with food to help digest food as you get older. All right, I'll come back online here. So what people do usually in a spa situation is they'll schedule like a 12-minute session. And in that case, it's usually lying down on a mat. Some people will do ozone therapy with it. You know, it could be something where they're lying down and they're getting their nails done, or a foot massage. So there's things that you can build up and create this, you know, great experience, this 15, 20-minute experience for the person where they're coming in. And it can either be provided as its own treatment, or you can couple it with other therapies as well. Classically, in a spa situation, it is a mat that people are lying down on. Some people are sandwiching people between mats. Another nice thing about it is you don't have to disrobe. You don't have to take any clothes off, or you know, put on this smock. You can just walk in with the clothes that you're wearing, because it does not have to touch your skin. Those of you that use PEMF know that. That's one of the great properties of having this system. That's why I use it in my clinic. People just walk in, sit down, use it. You know, there's no gowning up, and it's a great way to treat people without having them go through a process which takes a room and takes more time, and they're in and out. And, you know, for me, I can even train my patients how to use the machine so they can sit down, set up, use it, and walk away. Then I'm there observing while I'm working with other patients. But in a spa setting, it can be that way as well. If it's your spa, if you're coming in, you should be the one that's there, that's monitoring the system to make sure everything's working right. And again, drink water before and after. But as always, you know, you need to remove metal jewelry, cell phones, electronics, key fobs. And I was reading in one of the threads how people are using it on devices as long as they remove the battery, and that removing batteries isn't what this is about. It's having the electronic device near the PEMF coming through the system, and it may overcharge the small components inside that device and render it useless. And that's why you don't want to have any kind of electronic device near a PEMF machine. So if it's in the person, if it's a hearing aid, if they have an internal TENS unit or a pacemaker or diabetes, those are some of the things you have to avoid. They can't use PEMF. If you're smart enough, you know, you're going to say no to that. But some people are like, well, you know, as long as it's way over here and it's not here, well, there are some gray lines, but it's always, if you don't know, don't treat. And unfortunately, some of those people, they need it, but we can't give it to them because of the damage that PEMF can do to those devices. So for now, until we have a way of creating a little Faraday cage that goes over the device to protect it, and we know that it protects it, it's best to stay away from that. But like I said, making sure you're hydrated. And then you can actually put together a process where you can knock on doors to some of these places, like like your local place where you get your nails done, or in a gym setup, or just go to a local spa. And if you don't have a PEMF unit, be the person that comes in and says, how would you like me to come in and provide PEMF, and I'll just rent this little 3 foot by 3 foot section for you. So those are some great ways that you can get in. Again, have your card, have a little pamphlet, make sure it has a link to your website. It's got a phone number. We call it NAP, name, address, phone. So have those things on there and drop by, and they may be busy, and just say, hey, if you'd like to add PEMF, I noticed that PEMF is being used in more spas. Or if there's somebody that's down the road, just say, I noticed your competition's got PEMF. I'd be more happy to come in and provide that. And all I just need to do is rent, a small space, and or they can pay you per person and do a revenue share with them. So that being said, that is my short little live Facebook broadcast here at the AOPP headquarters, as you can see. Again, talking a little bit about how PEMF can be used in the spa niche. And you could pretty much go on to Google and type in PEMF spas near me, and you'll see 3 or 4 of them. So you can see how it's already being used, but you can capitalize on this ground swelling of it being used in an area near you. So with that, I want you to have a great week. Get outside, get some sunshine, get some vitamin D3 so that you can absorb more calcium, and be happier now that we're breaking out of winter and into spring. So have a great week, and I'll see you again next week with another broadcast. So take care. Thanks.